So delighted to see you this wonderful morning on the 26th of March 2025. It's such a beautiful Wednesday morning to be here with you and to be in the presence of the Lord, because every morning when we come here to talk about health, is that also we are coming to just talk about what God has done to all of us. So karibuni sana, and I'm very glad to be here, and I'm very glad to have you on board. I do value your time greatly. So today we're going to be having a good educative session up to 10 in the AM. But before that, nikukukaribisha sana, and just to tell you that we're very happy to have you, and our numbers are very open. Of course, we are ready to talk to you. That is 0721105105 on WhatsApp, 23814, our SMS code, which is absolutely free of charge. We'll be live on Facebook and YouTube. That is MBCI TV official on YouTube and MBCI TV on Facebook. And of course, this is MBCI TV, ambapo tunabadilisha maisha by the grace of God. And today's show is Afya Clinic, where we talk about everything health. Okay, now today we'll be talking about literally everything that pertains to health. And last week we asked you to tell us what you'd want us to talk about. If you have anything ambayo iko in the health sector that has been an issue to you or someone tulikuwa tumesema that you can talk to us through our numbers, and we'd be able to have a professional on board who would help us to talk about the same. And we got feedbacks, and of course we'll be looking into that and talk about that. But today's topic is very sensitive, very intriguing, and we'll be introducing it in a very short while as our guest will be joining us. But for now, we'd love to just know how you are doing, because we say that every morning is a blessing from God, and every day is another opportunity that God has given you to just be happy and talk about what God has done. So tulisema that every time is a time of Thanksgiving. So tungetaka kujua, what are you thanking God for? But also tell us wewe ni nani, unatusikiza ama unatuwatch kutoka wapi, unatuwatch na kina nani, and what exactly you are thanking God for. You can do that through our numbers that are 0721105105 on WhatsApp, as I had said, 23814, our SMS code, which is absolutely free of charge, and of course on Facebook and YouTube, and of course on all social media pages. Ukienda pale utafute Rachel Kahugu, we'd be able to get your feedback. Itume tu pale kwa inbox, nitaweza kupata ujumbe wako loud and clear. But now, karibu sana. Officially, we've started our show, which is really amazing. So thank you so much for being here. Feel at home. So today, as I've said, we are having a very intriguing, special, but sensitive topic. I'm about to talk in a very short of that, because I'd love to, just give you a minute or two. Just to tell us unatusikiza kutoka wapi na to watch kutoka wapi, and what you're thanking God for. I would love for us to take a very short music break, and then as we come back, we will be getting into this particular topic of discussion. So let's take a very short break, and then we'll be coming right back. Perfect. So as we had said, it's that will be a very short break, and now we are on Facebook, we are live on YouTube, and you're ready to hear from you. Today's discussion is a very emotional, intriguing discussion, because we are talking about why is it that we have ladies who lose their kids or their children during childbirth. And we've had that very many times, that a mom was going to give birth and they lost the kid, or hata yeye mwenyewe, she passed on during childbirth. And it's a discussion that has been there. And last week, the Nakuru County Health, they did something about that. There was a forum and a training to the midwives and the nurses, and we'll be talking about that as well. But if you have any question regarding the same, our numbers are very open, and we are very ready to hear from you. Na tungetaka tujue, what are you thinking about the same? Do you have any idea why that happens? So we'll be talking about that. And today on set, I'm not here alone. I am having Lillian, who would be helping us discuss these. So Lillian, karibu sana.
Thank you so much.
Thank you so much for being here.
We are happy to be here.
Very excited.
Yes.
Yes, asante sana. Yeah. Please say hi to the viewers and introduce yourself, and then we can get started.
Viewers, hi everyone.
Yeah.
Yes. We are ready to discuss together.
Yeah.
And any concern, if we can be able to address, we are here today.
Perfect.
Thank you.
Asante sana. Now give us a brief introduction about yourself. Tell us who Lillian is.
Yes. Lillian is one of the employee of the county government,
Yeah.
Nakuru, Department of Health.
Yeah.
And Lillian is a nurse, and a nurse who has specialized in reproductive health, and that is what I like most.
Amazing.
Yes.
How has it been so far?
It has been good.
Perfect.
Yes.
Asante sana. Now, today we will be having this particular discussion, which is very, very intriguing. And so generally the reproductive health. But today to specifically talk about why is it that we have kids who pass on during birth and how does that happen. But maybe we can start from the very beginning, from conception. So take us through.
Yeah. So actually that is a journey.
Yeah.
We say a journey of 1,000 miles starts with one. And I want to say this journey of women, pregnant women, starts immediately when they conceive. But however, it also starts even before the conception.
Yeah.
In what we call the preconception care.
Okay.
Because why are we saying preconception care? Preconception care is care given before you conceive.
Okay, and maybe before you continue from there, is that we'd want, because we are now talking about the preconception care.
Yes.
So preconception is, as you've said, before you get, before you conceive.
Yes.
So I'd like to just encourage you as a mom, as a lady, hata kama you're not a mom yet, of course you're looking forward to being a mom one day. So I'd like to encourage you as a mom or as a lady or as, a father, a husband who has this lady at home who will of course be a mother one time. I'd just like to encourage you that if you have any question that you'd want to ask, this is a very sensitive topic we're talking about today. So if you have any question you'd want to ask about the same, please feel free. As I had said before, especially on WhatsApp our numbers are 0721 105 105 23814, our SMS code, which is absolutely free of charge. Now, the preconception care is how you take yourself before you get that baby. All right, so this is a very important part for you. We'll be having a session where we'll be reading questions that you have sent. Sawa sawa. So this session that we'll be doing next is where you will be asking questions, like exclusively to answer your questions. So this is home. Today, karibu sana wendo mgeni wetu, karibu sana, sit and just be ready to ask and listen. All right? So Doc, let's continue from there, the preconception care.
Yes. I see this preconception care is care given before a woman gets pregnant. And this is a care which we have not really utilized well. And when I say we have not utilized well, is we still have women getting pregnant when they have not planned. And now preconception care comes in so that you are able to say, now I want to become pregnant, what do I do?
Okay.
I need to visit a health facility.
All right, so how long should this be, the preconception care? Because generally that should be, before you get pregnant.
Yes.
So is it 1 year? Is it 6 months before? How long?
You say 1 to 6 months.
Okay.
Yes. So from 6 months to 1 year, but 1 year is good.
Okay.
So that you're able to have ample time. And you're able to interact with your doctor.
Okay.
You're able to discuss with your service provider, nurses, and discuss how you want and when do you want that pregnancy.
Okay.
And now what can be done to you so that your health and also for the upcoming baby will be okay.
Okay.
Yes.
Okay. So what does it entail, the preconception care?
I say this is preconception care. So it is a care given to a woman who is wishing to become pregnant. So this care is a total holistic care given to that woman who visit a health facility to see a healthcare provider or a doctor. And the doctor will be able to discuss. And then from the discussion, the woman will be able to express her desires.
Okay.
Then from there, the assessment of that woman will be done.
Okay.
Yeah, from history taking, investigation, physical examination will be done.
Okay. Okay.
So that the main aim of preconception care is this woman should be healthy as she goes on to conceive. Okay. And so when that is done, the care that has been given will be able to say, is this woman ready to become pregnant now? Or she can wait a little bit longer? Okay. Or what could be happening? So So that is the main aim of that preconception.
Okay.
Yes.
Now I'm very interested to know, because you said that you weigh to see if the woman is ready for conception or not.
Yes.
Is there a test? How do you? What does it look like? Is it that it's a few pointers written down, and just to understand it? Also, as you answer that, is that you'd also want to understand, as a woman yourself, is there a way that you can know that now I'm ready, even without going to hospital?
I want to start from where you are saying whether the woman can know whether she is ready. Yeah. That is now the perception which is going on, and that is the practice. And that is the practice now we want to change and tell our women that the way you think you are ready may not be that way. So it is good to visit a health facility, and then you are able to be given this care. You ask me what the care entails. The care entails, I say, we take history from this mother, get to know her personal history, and then with the other histories also we get to know the background of the family, any medical history, any surgical history, because women are also human beings. They are subject to other conditions. They are subject to even other unhealthy behaviors, like even maybe overweight or obesity or such like. So the doctor or the nurse will be able to take that history. Then after that history, she will be able to examine, and then under examination, we say head to toe examination. You start examining every system of this woman to check whether it is okay or there are issues, and then from there now you can do the laboratory investigations to check that this woman does not have any other issue, and if there is any issue which needs to be addressed, then it can be addressed. So there are several tests which can be done, including the blood test, the urine test, and all that, which assists the doctor or the nurse to get to know whether this woman could be having any underlying condition. And then also on the health-wise, if the woman is okay, then advice also on the health-wise, nutrition part of it, and also what can she be done, because if the woman is okay and now all the examination are being done, then there are those advice that this, in case you want to become pregnant, now maybe we can give you supplements. So these supplements would be? It could be iron. Which are good.
You've mentioned about family history. Why is that important?
It is important because there are conditions which are passed from families, and you find that genetically they can be passed. And also, yes, we have quite a number, like maybe, for example, like maybe if you have history of diabetes, history of hypertension, it can pass. So those can also will assist, the care provider to get to know, are you prone? Could you be having it already? And if you are having it already, what can we do? Because we want to stabilize. We need to stabilize. If you have any medical condition, we need to stabilize it well, so that as you move in to get pregnant, you don't experience many complications as such.
I hear you. Now that's the preconception care. Now after that?
Now we said everything is okay, and you have done that, and that is what we are encouraging our women to do. So once the woman becomes pregnant, we are saying immediately the woman realizes she's pregnant, she needs to visit a health facility. Immediately she realizes. How does she realizes? Yes, we say maybe probably within a month. Women, some women also, when they get pregnant, they just have some symptoms, and even some women also can tell you, I think I'm pregnant. We are saying the moment that woman get to know that she's pregnant, she needs to visit a health facility. Also, that is a challenge in Nakuru, because women are really staying until late. Until they come when the pregnancy is already seen. But we are saying that is not a good practice. A good practice is the woman should be able to visit a health facility immediately she realizes she's pregnant.
Why is that important?
It is very important because remember, this is a pregnancy. This is something new in the body.
Yeah.
This is a baby. We are saying a baby already growing.
Right.
So we want this woman to visit a health facility because also our goal will be a healthy baby and a healthy mother.
Yeah.
So a healthy baby and a healthy mother now start. I said it started preconception, and now if we started preconception, we are continuing it now.
Yeah.
So we now want this mother to come to health facility as early as possible. We are saying within the first trimester or the first 3 months.
Yeah.
The woman should not go beyond there before she attends her antenatal clinic. So when the woman visits the clinic again, the same is done. We do the history taking, we do the physical examination, we do the investigations again to make sure that everything is okay with this woman. And if everything is not okay, what do? We start early putting intervention.
Okay.
Yes. Like I said, if somebody is already having maybe pre-existing medical condition, we now need to manage as early as possible.
Yeah.
If the woman is also okay and not having any medical condition, again, we need to nurture this growing baby well together with the mother, because there are many things which needs to be done, starting from the behavioral factors, starting from nutritional factors, starting from prophylaxis, starting from just counseling, because you know a pregnancy on its own, its own, it's a challenge to women. We say every pregnancy is unique, and it is a stress on its own, so we want to journey together.
I had someone saying that she was actually expectant at that point, and she was saying that when a woman is expectant, she's usually like unwell for the 8 months. It's just 1 month in between and probably some days where she's like fully okay. But 8 months, it's usually months of, you know, going to hospital, you're probably sick. But as you said, it's that pregnancies are usually very different.
Yes.
Now we've talked about after you've conceived.
Yes.
And you've realized that you're pregnant and you now go to hospital. Now at this point, what would be the danger, or what would a mom do wrong that would now cause, you know, maybe passing on of the child at birth? Is there anything that inaweza kuwa ilichangia at this stage?
Yes, thank you so much. I want to say, I told you this is a journey. And we are saying when a woman comes now for antenatal care services, she will be taken history, she will be examined, investigation will be done. And if there will be any underlying factors, I would say, this will be dealt with immediately. And also counseling part of it, on the nutrition part of it. How is this woman supposed to adhere to her diet? How is she supposed also to come for subsequent services in our clinic, and that part we say we are doing counseling part of it, so that we are also telling this woman what are you supposed to do and what are you not supposed to do. Then in the process also we check the well-being. As we check the well-being of the mother, we also check the well-being of the baby in the uterus. So also we monitor, and then we tell this woman what are the things that, as you continue with this pregnancy, what are the things that you will be observing on your own? Because we say you become your own doctor, number one, before even you come to the health facility. So this woman is taught on what we call the danger signs. The danger signs are the things which send signal to this woman that things are not moving on well. What am I supposed to do? I am supposed to rush to the hospital. So we tell them, we take them through the danger signs during pregnancy, and as we progress, we also take them through danger signs during labor and delivery, and we also take them through danger signs during postnatal. So this woman should be able to understand what is normal and what is not normal. Since you say the women are saying they are mostly sick, but we say pregnancy is not a sickness. If you are okay, it's just challenges which come in between. Because there are changes in your bodies which are going on. There are hormonal changes in your bodies which are going on. So when this woman come and visit health facility, they will be able to journey with the nurse. They journey together. All those challenges will be able. And I said the utmost goal is to have a healthy mother and a healthy baby. So this woman will be able to be told about the danger signs. These danger signs are being told to our women. But what happens is sometimes that is where the issue is. The woman may not recognize danger sign early, and the woman may not give attention to that danger signs, because most of the danger signs which come in pregnancy, it doesn't sometimes make somebody to become very sick. So that somebody will wake up and run to the hospital. There are small things which happens to that body of a woman, and there are things which the woman immediately she realizes or see, she should be able to wake up and visit a health facility. So those are the things we start. Not recognizing danger signs and not reacting to it. Yeah.
Now, I'd want us to go through these danger signs.
Yes.
All of them.
Yes.
So that if there's a lady who's watching us and she's expectant, she'd know that nikiona hii any danger natakana niko hospitalini immediately, like yesterday.
Yes.
Yeah. So what are these danger signs?
Yes. Danger signs in pregnancy. Number one, if the woman wakes up in the morning and she has a baby face, she's like baby, swollen. They say swollen. It's like, you know, when you are swollen, it's like I can't see. It's like my face is. We say baby. And then also the swelling can also extend to the feet.
Swelling of feet is not normal?
It's not normal. We are saying let the woman just go to the hospital. And the doctor will say this is okay and this is not okay. Yes. So the swelling, especially of the face. And it goes to the limbs severely. Yes. We are saying that is not good. Yes. Number two.
Very interesting.
Yes. Number two is now if the baby, depending on the gestation or the number of months of pregnancy. There are those men, as we start, the woman may not feel the baby moving in the abdomen. We call fetal movements or fetal kicks. So as the pregnancy extends or progress, the woman should be able now to start from around 5 months to feel the movement of the baby in the uterus, and as it progresses, the kicking of the baby. So we are saying if the mother feels, because the mother will be able to realize the regularity of that. If the mother realizes that has changed, the pattern has changed, or there are no movement at all, then she should be able to wake up like yesterday to rush to the hospital. If the woman starts bleeding, bleeding in the lower genital tract, there should be no bleeding in pregnancy at all. Not even a drop. There should be no bleeding at all. Yes. It should stop until you deliver. There should be no bleeding, not even a drop.
And how bad is too bad? I know that question is usually asked so much with ladies. How bad is too bad? If you are bleeding but it's like spotting, is that alarming? In
pregnancy, it is an alarm. So we are saying any kind of bleeding, any kind of blood seen coming from that law is a danger sign. Yes.
So bleeding.
Yes. High blood pressure. How do you get to know high blood pressure? You may not know, but the mother may feel severe headache. Severe headache. And we are saying if you have severe headache, please don't assume it is malaria. Don't assume it is tiredness. Don't assume that it could be other. Rush to the hospital so that the doctor or the nurse should be able to examine you and check your blood pressure and say. Another thing is convulsion. A woman who is pregnant convulsing is a danger sign. Convulsion or fits. It's a danger sign. The other one is a woman who has fever, hotness of the body. Because it's saying there's already an infection. So we are saying this infection, where could it be? It could be somewhere where it could be affecting your baby. So we are saying all that when a woman realizes that in pregnancy, she should be able to rush to the hospital as soon as yesterday. That is where now we have issues. Yes.
All right.
Yes.
So any of those danger signs, and I love that you said ukiona atakama it's just kidogo, make sure you go to hospital immediately. Because we've been saying on this show is that most of us tunapenda sana self-treatment. And Dr. Google. Which is very wrong. So as you've said that this is what unfortunately graduates with time, and it then happens that during delivery it then becomes a problem. So if you see any of these danger signs, make sure that immediately you go to hospital. Now, before we continue, I'd love, maybe we'd get to know if you have the myth busters ready so that we can check some of the myths that's around this particular topic.
Yes.
Because, you know, most of the people have very many discussions, and kila mtu anakuanga advisor. Kila mtu anakuanga advisor.
Yes. Very many of them,
especially ladies.
Yeah.
Ladies know how to advise each other.
Yeah.
Yeah.
And I want to tell the women, no one is same as the other one.
Yeah.
No one.
Yeah.
Yes. Even that pregnancy will never be the same like the other one.
Yeah.
Every pregnancy is unique. And you treat it uniquely.
Yeah. And you've said if a lady was pregnant, she shouldn't advise the other lady according to your experience, because your experience and the other person's experience, they're different. And by the way, before you get them with pastors, I'd love to know, for a lady who's having maybe her third or second or third pregnancy, should she treat it the same as a first pregnancy?
Wow. That is now where the mistake is. You now assume, and the woman say, I've been carrying maybe like 3 pregnancies or 5 pregnancies. This one will be like the other one. Let me tell you, I've just said, no pregnancy is the same as the other one. It comes with its own unique challenges. And that is what we are saying. We take every pregnancy as it comes. That is now where the women go wrong. They assume. And I told you, these danger signs, they are not so aggressive to make someone to sleep, or there are things which can happen, and the woman still continue doing her normal duties, and that is where the issues. The women will say, si mbaya sana, let me just persevere, let me get a banado, and that is where the issues come. And when they report to the hospital, it's already too late.
Okay. All right, now let's take a look at some of the mythbusters so that we get to understand and, you know, just see what are some of the myths that surrounds pregnancy and child delivery. And as you're there as well, we'd love for you to just tell us, what are some of the myths that you've had and it didn't work for you, and you now knew that this is a myth, surely it doesn't work. So please share with us. This is, you know, even the word says that everything that is written for our learning, so that we would have to go through the same, you know. So this is also the same as that. Everything that you have gone through or what you are telling us, it's for our learning, so that while you're there, you won't have to go through the same. You have learned already. Now let's get some of the mythbusters. All right. So the first mythbuster is that if a woman loses a baby, she is unlikely to have a successful pregnancy in the future. Is it true or is it a myth?
Let me say that's a myth, because that is not true. Because whatever made that woman to lose a baby may not be known, and it may not be able to come again or affect. So what we need to tell these women is, please, that is not true, because whatever the cause was needs to be identified. And I want to tell the women, most of these causes, causing these issues of losing the baby, they are preventable if only the women can act early. So it doesn't say that when you lost one baby, you'll not be able to get another pregnancy. No, we are saying now visit a healthcare provider. The healthcare provider will get to know what happened. What really happened? Was it something which could have been preventable? Is it a condition which needs to treatment? Did it resolve, or what happened? And that is what we say, the preconception care, very, very important. And antenatal care.
Perfect. And you said it should be around 1 year?
6 months to 1 year. 6 months.
Yes. That's good.
Yeah, when you want to.
Perfect. Let's go to the second mythbuster and see. Yes, so the second mythbuster is that it's the mother's fault. That losing a child at birth is always due to something the mother did or did not do.
Wow, that's a myth. Because what did the mother do? There's nothing. It's only that maybe she failed to go to the health facility on time, or it could have been something which was not avoidable. So it's that a total myth, and we want to tell the women, please don't take blame, because that is now what the culture in some communities, they blame women, that it is you. You didn't do this. You know, even in our family, you didn't do this. Let me tell them that is a pure myth. Please come to the health facility, we journey with you, and we shall be able to assist you.
All right. On to the next one is that stress during pregnancy can cause stillbirth. Maybe before we go into that, just explain what stillbirth is.
Stillbirth is I just want to explain in a layman language. Still is something not movable. Still is something which has no life. Yes. So we are saying stillbirth is a baby who has already died. A baby born who has already died. That is a stillbirth. Yes. The baby is lifeless during delivery. Yeah.
And you've had questions of people asking, is stillbirth and miscarriage the same? So now that you've explained stillbirth, now explained what is to miscarry. What is miscarriage of a baby?
Miscarriage of a baby. We know we have abortions and miscarriage. Yeah, they are almost used interchangeably. But the society prefers the softer one, which is miscarriage. They say because of the myths which are associated with abortion. So we are saying a miscarriage is a pregnancy which has been terminated before time. Before time, at least before 28 weeks of gestation. Yes. Yeah.
And I know that's a very wide topic.
Yes, that is a topic on its own.
Yeah, it's a topic on its own. Hopefully we'll get a day where we talk about what are the causes of that, and how to avoid miscarriages and stillbirths. And I know we'll be talking about that. But on the second Mythbuster, it was that
stress.
Let's get it. Yeah, that stress during pregnancy would cause stillbirth.
I want to say the answer is no. Yes, I say the pregnancy has its own stress, but those are not the stress which make the baby to die in the utero. There are other issues which bring, because stress can be managed, and that is what you are saying. When you come to the health facility, you are counseled, you discuss, you talk with a healthcare provider, and the healthcare provider will be able to pick what are the issues you are undergoing, what are the challenges you are undergoing, because those are the things we say they give stress. So when you journey with the service provider, when you journey with the nurse, when you journey with the doctor, they will be able to assist you go through those stress. So those stress does not lead to stillbirth. There are the causes of stillbirth, which I said when a woman comes early, it can be investigated and it can be done. And as the woman progresses with the ANC care, antenatal care, those factors can be detected on time.
Okay, perfect. The last one is that babies move less towards the end of the pregnancy because they have less space. Wamemaliza space yetu.
That's a layman perspective. Yes, that's a layman perspective. I want to say,
I saw that and laughed.
Yes, that's a woman perspective or a layman. Yes, let me say. The layman thinks now as a baby grows, the space is no, not at all. The baby always have enough space. Whether it's 2 kgs baby, whether it's 5 kgs baby, whether it's 3.5 kgs baby, the baby has enough space. And we are saying the baby should be moving even more as we approach delivery.
Okay, why is that?
Why? Because the baby, you remember when we were progressing with the pregnancy, that baby started small, then the baby got all the human features, then the human features as we progress started functioning, and as we go towards the end of the pregnancy, all the organs are functioning. Why should that baby now move and all the organs are now functioning? And the baby is ready to come outside and face the world. Yes.
Okay. So movement of the baby, it starts at how many weeks?
There is what we call quickening. Quickening is when the mother feels the first movement of the baby. I said around 20 weeks, which is 5 months pregnancy, is when the mothers start experiencing. And even when some mothers did not know they were pregnant, they will tell me, I heard there is something moving in my abdomen. And even some mothers even think, because they were not prepared and they didn't do what we call preconception.
How did you know you are pregnant at
yes, they are thinking there is some movements, and some say, what could be that? Maybe I have some something in the abdomen.
But you I always have this question, and maybe this would help the ladies as well. For the people who don't realize they're pregnant at like 3 months, really, how didn't you know you're pregnant at like 3 months? It's not out of ignorance, but I feel like we need to talk about it more as ladies, and we'll be talking about the training that you had.
Yes.
Was it last week?
Last week.
We'll be talking about that, and also just expand to talking to the ladies, to the women in general, because how did you know you're pregnant at 3 months? That means you haven't gone to hospital for 3 months. And even also we are saying the women are refusing somehow
to be sensitive to what is happening in the body. Because you will always become sensitive. Yes, for some women maybe who had regular menses, of course the menses will be able to stop. That could be able now to, maybe those women will get to know immediately they miss the first menses. They know I could be pregnant. I could be pregnant, because missing menses also does not mean you are pregnant. And that is why I said they need to visit a health facility as soon as possible. Then the other thing again is when the woman now ignores, or maybe some women also become pregnant, especially if you are breastfeeding and you have not received your menses. They may not know, because they are thinking, I'm still safe. And that is what we are saying. When you move to the health facility, the health provider will be able to advise you, how do you move? So we are saying, yes, probably there are those women who may not know, because they didn't have menses, maybe they were breastfeeding, or they were in a contraceptive, and maybe a contraceptive failed. But we are saying, as now pregnancy progresses, there are things which changes in that body of that woman. And I'm saying they need to be sensitive, so that they go to the health facility and say, check me, could I be pregnant? I'm feeling like, I'm feeling this 1, 2, 3. Of course, the woman will be able to explain what she is feeling. And the nurse and or the healthcare provider or the doctor will be able to know from that history taking. So that's saying, I'm not sure, I didn't know. I want women to be more sensitive now and love themselves.
That's very important. All right, now we are moving closer to the 9 months. So as we move, is there something else that you know, ladies need to be very careful about, just to make sure that their baby grows very well and that they are also delivered very well, and them themselves as ladies, just to make sure that they also stay healthy during the pregnancy?
Yes. I said immediately the woman become pregnant, she needs to go to the health facility. She will be booked for clinic visits. And we are saying now, currently, the woman should be able to have 8 contacts with the doctor or the nurse or the service provider. At least 8 contacts. Because those 8 contacts has been individual and itemized. At first visit, what are you, when you come, what do we do for you? Second one, that one, fourth one. And as pregnancy progress, you will be able now to receive, we say, almost holistic care. But the challenge is the women start late. When they start late at 7 months, you have only 2 months to deliver. How many visits will you come? You will come a few visits, and you realize we shall not be able to give you the much we wanted to give you. So it's like now we shall be dealing with more pressing issues, because you are approaching pregnancy. For example, if you had anemia, or low blood in your body, we may not even have time to correct when you come at 7 months. But when we correct, immediately you come. At maybe 2 months, we shall be able to grow that or build your blood level until when you will be going to delivery, you have in our blood. So that you are able to now to reduce those complications which arises. And now that takes me to the discussion where we talk about ladies who already know there are a few issues, you know, like ladies who know their blood count is low. So, and they know that they are expecting, like they want to get pregnant, they're planning to get pregnant. Back to the antenatal care. So if you didn't know about the preconception, or prenatal care.
Oh, it's safe. Prenatal care. If you didn't know about the prenatal care, but then you've already gotten pregnant and your blood is low, probably, of course, that means your iron is low as well, your calcium pia iko chini. For such a lady, what are some of the foods, or what should your diet look like?
I want to refer back again to that initial and visiting health facility. I say there are many things. Probably maybe I need to itemize. I said we take history and get to know, are you predisposed? Do you have any underlying condition? If you have any underlying condition, we take care of you. And if you don't have, again, we tell you how do you journey so that you are not predisposed, because there are those others who are already having maybe history of a medical condition in their families. So those people we say, or those women we say, they are predisposed. So they need that close care. Then another thing, again, we examine your body to check that there are none of the issues or complications happening. Then we do the investigation. The investigation, we do blood, we do scanning, ultrasound scan, and any other urinalysis, we do that. We do blood to check what are we checking? We are also checking if there are any other First, we are checking the blood level.
Okay.
To get to know how is your level of blood. Because as the pregnancy advances, the baby also will require so much. And if the woman is not nutritionally well, the woman will be having complications. Okay. And the baby also will not get enough. So we check the level of your blood. Yeah. We check also your blood if it is having any infection, if it is having any condition. We check STIs in your blood. Okay. Like there are STIs which when a woman has and she's already pregnant, those STIs will pass through the mother to the baby. Okay. Example is syphilis. Another one is gonorrhea. When you deliver with gonorrhea, the baby will have gonorrhea. The baby will be infected with the gonorrhea, and it can lead to blindness of that baby being born with a woman who is already having gonorrhea. Okay. We have other conditions among many like HIV. If the woman is already having HIV, the HIV also, if no care will be taken, the HIV will pass through the placenta to the baby. And many other infections. So you find that we check those infections which can be passed from the mother to the baby. Okay. And also if they are there, what do? We treat you on time, and then also we give you medication. Okay. Like for HIV, we give you ARVs. Like for STIs, we treat you so that chances of you passing to the baby is minimized. Okay. We check also your urine. Does it have any issues? Are your kidneys doing well? Do you have issues in your kidneys? Do you have other STIs which can be happening? Then it will also tell us. And also it will also tell us, could you be having a complication which could be setting in, which is a high blood pressure, and in the extreme end we call it eclampsia, which already has complicated and it has also already affected your glucose level. The woman is passing glucose in the urine which is not supposed to be passed. Okay. So those things are done. Those ones which are done every time you visit a clinic. And there are those ones we do once, and there are those ones we do twice. Okay. So if a woman will be able to start early, she will be able to benefit among all this. The other thing also, we scan. We scan the growing baby. The first one between 16 weeks and 20 weeks, that is 4 to 5 months. We check this baby and say, for the mom. Yes, we check this baby. Is the baby doing well? Could the baby having what we call congenital abnormalities? What can it be done? Also, we confirm for you the gestation and say, you are saying 5 months. Yes, it is true. This baby is for 5 months. Okay. So those
you know that from scanning? Yes. Like the exact months?
Yes, yes. We do to confirm. Okay. There are women who come and say, I didn't know when I conceived, so I don't even know how many months now. Yes, there is a way a nurse can know, but also cannot be exact. Okay. But the scan can assist us to give us almost to that. Yes. All right. So there are those many things that we do. And all these 8 contacts, if the woman will be able to come and start early, she will be a benefit from all those. And now the health education part of it. How do you behave? How do you eat? How do you do exercise? Yes. Okay. How do you wear your clothes? Many things which make the mother to journey and really love that pregnancy. Okay.
Now this is also, maybe you can just touch on it. Are there specific clothes that ladies need to wear when they're pregnant? That's also a discussion that we've had quite a lot. They have to be very comfortable, but also look good. So are there specific clothes, especially at like 7-8 months when the bump is already big?
We are saying, I say the pregnancy, this is something which is growing in you, and it will come with some uncomfort. And we are saying the woman should be able to be comfortable, not wearing tight clothes, tight jeans, tight dresses. It should be loose enough so that you are also comfortable and you are not stressed. Okay. Yes. Okay.
Perfect. Now, this is a call to everyone. For you as a lady, because you've said that it's very important. If you are planning to conceive or you are already pregnant, it's very important for you to always be in touch with your doctor. Charlie say maybe with your doctor, with your nurse, because it's very important. It is very important for you as a mom and for the baby as well. Now, as we come back, we'll be taking a very short break in like 4 minutes. But as we come back, we'll be looking at, now, what are the causes after we've done all that? So now, what would be a potential cause of child loss during childbirth, or of the death of this baby during childbirth? Or even worse, what would result to a mom dying during childbirth? Because they're very unfortunate cases, but they're there. And maybe we'd love to know what's the rate? Is it high, especially for the kids? Is it something that happens?
Well, it's really happening. We are losing mothers, and we are losing babies. The worst is losing a mother and a baby. That is the worst part of it. And I know no one would love that outcome. Yes. Okay. So it is happening, but we shall discuss, because as the Department of Nakuru, Department of Health Services, led by our CC, Madam Rosalyn, we are really doing a lot. She's really supporting that. She is looking all corners to ensure that we minimize, even not completely stop, the loss of the mother and the baby. She's really running around the clock, supported by her leadership. And now us, we are also there, so that we are able to do combined forces and minimize, reduce it if we cannot be able to eliminate.
And I'm really positive that we can be able to actually eliminate. And you know, this goes to a very personal level, because even as healthcare providers, you can only do so much. If you don't decide to actually do it by yourself and go to hospital and take care of yourself as much as you can, even though as healthcare providers you're trying as much, then we might not be able to eliminate. So this is a call to you as well, to take care of yourself as much as you can. So we'll be talking about that as we come back. Now we'll be talking about what are the causes, but also I'd love to encourage you, if you have any question that you'd love to ask about the same, I have already questions coming in and we'll be coming to answer all of that. If you've had a complication at any point during your pregnancy journey, or you've ever had a complication before, or you've had someone who had a complication before and you're wondering what really happened, this is where you ask the question and you get clarifications. Or if you're planning to get pregnant and you want to get clarifications on a few things, this is also where you get the clarifications, and this is where you get all your questions answered. All right, now we'll be taking a very short break, and then as we come back, we'll be coming back to do all that. Just to remind you that this is MBCI TV, ambapo tunabadilisha maisha by the grace of God. And of course, the show on air is the one and only Afya Clinic, where we talk about everything health. Our numbers are very open and ready for you. That is 0721 105 105 on WhatsApp, 23814, our SMS code, which is absolutely free of charge. We are live on Facebook on MBCI TV Facebook page, and they're live on YouTube on MBCI TV official YouTube page. My name is Rachel Kahugo. Very glad, excited to have you here. Thank you so much for your time. As we say every time, is that we do value your time greatly. But you're not done yet. We're going for a very short break, and then we'll be coming right back.
MBCI Television, transforming lives.
Huyo mnyama mwenye ako kwa flag ya Tanzania, hebu nitolee sauti yake.
Shut up everybody, listen.
Kukuku. Kukuku.
Oh my God.
Ni kaunti gani iko na watu wengi sana Kenya?
Inaitwa Tanzania. Tanzania.
Kuna huyu mtu alikuwa anaitwa Charles Darwin, alikuwa president wa Kongo ama Uganda?
Kongo.
Mtaka cha mvunguni?
Sharta iname.
Ujinga mwingi?
Akili kidogo. Akili kidogo.
Jacob and Esau walikuwa brothers. Sawa? Jacob and Esau walikuwa brothers. Naomi na Ruth walikuwa aje? Walikuwa related aje?
Twin sisters.
Juma hili tumeangazia hili.
Stooge ni aina fulani ya upendo ambao watu wanaweza kupendana. Una uungu ndani lakini hauna umahaba, hauna eros ndani.
Na hili.
Ukiangalia Shadrach, Meshach and Abednego in a foreign land, they had position, they were respected, they were honored. The king feared them.
Na hili pia
kuna venye tume interpret mapenzi in a different way venye haipaswi. Sasa unasema mapenzi ni kupewa pesa, mapenzi ni nywele itengenezwe, mapenzi ni nguo inunuliwe, mapenzi ni unipeleke na jet.
Tumeona mtu anakonda anajikondea kabisa anakaa mzeti kwa sababu ya mapenzi.
Mazungumzo haya Maisha na Biblia ni kila Alhamisi saa 1:30 hadi saa 4 asubuhi. Yanakujia moja kwa moja na kwa wakati mmoja ndani ya radio na runinga wipendayo ya MBCI. Tunabadilisha maisha.
Are you looking for a structured way to grow spiritually in the year 2025? Start your year with Nuggets of Destiny 2025. Dive into daily inspired teachings designed to motivate, rebuke, and guide you in fulfilling God's mandate. Order your copy today. For orders in Nairobi and its environs, please call 0799 573 310. For delivery to any part of the country, please call 0721 510 050 or 0722 344 360. Alternatively, get your copy in person from any of our 4 main outlets. 1. The Gift Shop at Kingdom Seekers Fellowship, Nakuru. 2. The Gift Shop at Heaven's Gate Prayer Mountain, Gilgil. 3. Shop A, 22, first floor, Star Mall, Tom Boyer Street, Nairobi. 4. The Sales Desk at Kingdom Seekers Fellowship, Thika Road. To place your order today, send us a message right now and start the year 2025 equipped and empowered for spiritual growth.
MBCI Television, transforming lives.
All right, we are back after that very short break. We had promised that it would be a very short break, and as you've seen, a very short break. But of course, you've seen some of the things, some of the shows that we do, or rather that we have here at MBCI TV. We say that MBCI TV is a family TV. So you've seen Biblia na Maisha, you've seen Kichiko Dawa, and of course, all the shows that we have here are very wholesome, and they're family shows that you can watch you together with your kids, together with your parents. Yeah, so as you always say, this is home, this is the place to be. And if you have your friend or your family member who doesn't know about MBCI TV yet, surely be a good friend to them and tell them about MBCI TV, because here you get educated, you get to have fun, and also you get to experience God. Yeah, because we say that here we transform lives by the grace of God. All right, now this is Afya Clinic, where we talk about everything health, and we're here with Lillian, and she is a nurse who's serving with Nakuru County. And today we are talking about a very sensitive topic. As we had said, we're talking about why is it that we have women or ladies who lose their kids during birth, and why do you have ladies who even, you know, die during childbirth? It's not supposed to happen. But we've seen the Nakuru County Health Sector doing their best to reduce, and even as Lillian has told us, eliminate, if possible, the rate of child loss or even the death of mothers, which is very important. So if you have any question about the same, our numbers are very open. That is 0721105105 on WhatsApp. You would be very ready to, get your feedback. And of course, on our SMS code, which is absolutely free, that is 23814. We are live on Facebook, on MBCI TV Facebook page, and live on YouTube on MBCI TV official YouTube page. Share the links as much as you can, because these will help someone. And for the mothers, we've said that apart from you getting educated, is for you to take a step. Because if you do not take that step to take care of yourself and your baby, then the healthcare provider hata kuja home kukuforce uende hospitalini. No, it has to start with you. So today we are having Lillian. Asante sana for being here. We've had a very wholesome conversation before the break, and I know that we'll have more of these conversations. Now, we have very many questions coming in, but we'll read 2 or 3. And then we'll be continuing with the conversation, because we have so much to cover before we finish today's conversation. And I'll start with huyu ambaye hajatuma jina lake, but it's fine, do not worry. For today, tunakubali. Anasema good morning and praise the Lord. Good morning and amen. Anasema I got a stillbirth on my first pregnancy, yet I had never had any illness or signs of poor developed baby from previous scans. The doctor said he would not explain how it happened. I later got 3 babies, but I still wonder what would have happened. I had taken preconception care. So Noliza, what would have happened?
Yes, Rachel, I wanted to say that yes, we are saying the best is to protect.
Yeah.
But there are also things that happen, and we say the causes are known. So I want to encourage this viewer now that there are also some things maybe the doctor could not have identified at that time.
Yeah.
And we are saying the cause could have been unknown. But I'm happy that she was able also to get other babies.
Yeah.
And we are saying whatever was causing, but we are saying let her not stop.
Yeah.
So that I'm sure she continued attending the clinic and doing the preconception care.
Yeah.
And that is why she is able to have the other babies. So there are many factors also which can also occur to the baby, which may not be known. Yes.
Okay.
Yeah.
And I've seen another very interesting question on Facebook where she's asked, the preconception care, is it for the first pregnancy or is it for all pregnancies?
Remember the term is preconception care.
Yeah.
It is not saying the first pregnancy. So all the pregnancies, all of them.
Yes.
You want to become pregnant, get the care first. Yes.
Very important. Yeah. Anasema my baby was not moving that much in the womb. After delivery, the child got jaundice and then high muscle. Yaweza kuwa sababu ni gani?
Oh, wow. It also takes me back to what we said. When the woman comes, what do we normally look at? I say we are going to check the blood.
Yeah.
And among things also we are checking on the blood. Maybe probably I didn't mention because I said there are many other things. One of them is blood group and what we call the rhesus factor.
Yeah.
Yes. So it is always good the women get to know what is their blood group.
Yeah.
Because their blood group will always affect the baby she's carrying. Because if the blood group of the baby and the mother is not matching, if the rhesus factor of the baby and the mother is not matching, there is that, what we call reaction.
Okay.
And that one needs to be addressed because there is a care that can be given.
Okay.
There is an injection that it can be given so that you minimize the reaction between the mother and the baby.
Okay.
So those are the things which also the mothers do not know. And it is also very important, and it's also very important for even those women who miscarry or had an abortion because they have already carried a pregnancy. It's good for them to visit a health facility to get to know what was their blood group.
Yeah.
And especially for those ones who are rhesus negative, in case they carry a baby who is rhesus positive, they react.
Okay.
Remember, the baby will carry either blood group of the mother or the father.
Yeah.
So it can be either. But now when we get to know about the mother, she's rhesus negative, then we are worried about the growing baby.
Okay.
So that could be also one of the reasons which can cause jaundice after delivery. There are also other reasons which can cause jaundice on the baby. We call it physiological. It happens. It is the normal way of the baby. It's only that the degree matters. When it is too much and how the mother will get to know too much. Yes.
Okay.
Yeah. It is normal. The slight yellowing of the baby kidogo is normal within the first few weeks of life.
Okay.
Yeah, because the baby is doing what we call, the baby is now adjusting. The baby had what we call the high hemoglobin level. So the baby now is breaking down and that is also released through the skin. And the mothers are normally advised to get the baby to the sunlight kidogo, yes, so that they are able now to clear that. But now the severe one, which happens immediately the baby is born within 24 hours, is what we are saying now, what we call it pathological. There is a cause, there is a reason, which means there is already an underlying reason. So it is always good when that happens again. Actually, we have not mentioned about danger signs of the newborn. That yellow discoloration which occurs immediately, and also it occurs, it is good for the mother to return the baby, and the nurse or the doctor tells the woman this is okay or this is not normal. Yes.
Okay.
Then the other thing also on the danger signs of the newborn is when the baby stops breastfeeding. The baby should not be able The baby and the breast should be
one.
Yeah, should be one. So when the baby now refuses, it is telling you there is something.
Okay.
When the
There's
baby,
a problem.
Yes. When the baby also is lethargy, it doesn't have any strength. Tunaita yani that baby is not interested.
Yeah.
That's a danger sign of the newborn.
Okay.
Yes.
I see. Yeah. Now, maybe we just read that last one, and then okay, we'll read the last one and then we'll read more as we finish up. Anasema nito Brenda kutoka Bomet. Anasema I gave birth last year, I think at the end of last year, and then niliongezeka siku, but hakushoda vizuri. I think that's what she's explaining. She was, tell me if this is right. There are people who say that,
yes, she was not done the best.
Yes,
in simple terms.
Yes,
yes.
That's
how does it happen?
What am I supposed to do?
Okay, it's not yet late. If she's not comfortable, because we are saying a woman should be comfortable, and you know during delivery there are adjustments can be done. Depending on the baby, the birth canal may not be able to accommodate the baby, and so what we call the extension can be done, but it is supposed to be sutured. And if she feels that it was not done well, she needs to visit the health facility again, and then she can be repaired. It's not yet late. We want her to be comfortable. Yes,
very important.
Yeah, we are sorry for that. It should not happen.
But anasema umesema it's not too late.
Yeah, it's not too late. It's not too late. Yeah.
Okay, perfect. Now let's talk about, I promise we'll be coming back to read the feedbacks. No, nani nyingi sana. But it's important for us to talk about now what are the causes of child death during childbirth.
Yeah. Or still partner.
Yeah.
Yes, what are the causes of stillbirth? Or even that baby who comes lifeless.
Yeah.
There are many causes, starting from genetical, starting from medical conditions, starting from acquired condition. Yes, I said acquired condition, which can be STIs, it can be malaria. You know, even malaria also affects the unborn baby. So that is part of medical condition, STIs, and all that can cause a death of the baby in the utero. But what I want to say is all this what I'm saying are preventable. The goodness with it, it can be prevented.
Okay.
If only the woman can do what we have just discussed, it can be prevented, because as you journey with this mother, you will be able to pick that, and you will be able to act on time. If it was a medical condition, can it be stabilized? Can it be managed so that it doesn't cause harm to the baby? Because if the condition now, like maybe diabetes, if the diabetes in the woman is already pregnant, the blood sugars are high, it crosses into the baby, it affects the baby. And if it affects the baby doesn't have that, and we cannot reach the baby to treat the baby at in the utero. So the baby now will have those complications in the utero. And it may make this baby to die even before delivery. The other things I told you are STIs, HIV, it can cross and also affect. And now as we move, we are saying we need to eliminate. We need to eliminate the transmission of HIV to the unborn baby by 2027, and it is very possible. So those are STIs. We have congenital factors. Congenital, it could be now within the baby. The baby could be having congenital. You remember I said it is good when the woman comes for scanning, so that that can be identified early, so that intervention can be done early. And then also, as we move towards term, as the pregnancy now goes towards delivery, there are other factors again. During labor and delivery, the labor is stress on its own, and that is why we are encouraging all women, please come and deliver in the hospital. Don't deliver at home. Because that labor, again, labor pains is a stress to the mother and the baby. And the baby also can get what we call the fetal distress. You know, the baby gets distress in the utero already. During labor, and if nothing is done, that baby also can die in that utero if nothing is done, because the baby is already distressed. But if the woman comes to the hospital, that can be realized on time, and intervention can be done. labor can be augmented, delivery can be expedited, and other options like cesarean section can be done, so that you are able to save that baby. So there are many factors which can cause the death of a baby in the utero. But what I say, majority of them are preventable. If the woman can come early. I also said, I mentioned something about malaria. Nakuru is not a malaria endemic zone, but a woman can travel. Yes. So if the woman comes to the health facility and she has those signs and symptoms of headache, and she comes to the health facility, and the nurse or the doctor come and say this could be malaria, the treatment can be done, so that it doesn't cross to the baby. Yes, very important. So there are many factors.
Okay. Now we've talked about what causes the stillbirth. Now let's talk about the mom. It's so sad that you have moms who die during child's delivery.
Wow.
What's the cause of that?
Yes, we have touched shortly on the causes of the death of the baby in the utero. Then we just finish about the death of the baby, because also the baby also can be born alive and die within 24 hours. Yes. And die within 24 hours, which is also not good, because I say the ultimate goal was to have a healthy mother and a healthy baby. If the mother now loses the baby, and remember, you have the baby as the mother has churned, the mother has bonded with this baby, it's also a loss which is not good. And we are saying most of the deaths also occurring in the infants below 1 year, it occurs within that first days of life. And we are saying also the main cause here is prematurity. The baby is born before the due dates. It could be between after 28 weeks, but not after 37 weeks, because term baby we are saying should be able to complete 38 to 40 weeks. That is 9 months as per the layman. We say 9 months. But now as we use weeks, so that we are able. So those ones are the major causes. If the baby is born premature, the baby adapting, especially if the baby now is born at home, reaching health facility without prematurity, the baby cannot breathe on its own, the baby succumbs. Sorry. So what is it supposed to be done? If the woman was delivering in the hospital, we have newborn care units where the baby can be taken. The baby also may have complication during labor. I say it's a stressing. So the baby may not even have be able to breathe on its own. So what you need to do, you need to assist this baby to breathe immediately after delivery. If the woman also delivers at home, who does that one? Yes. So all that. But again, if the woman labors at home and only come to the health facility late, when she's almost delivering, there is nothing much which can be done. So we are encouraging women, just come. When then labor pain starts, come to the hospital. Let the doctor and then or the nurse or the service provider tell you are still far, maybe go home and come, or wait, we shall be able to admit you and monitor you. So we are encouraging all women, please, let us deliver in the hospital. As we talk now, not all deliver. Again, as we talk, not all come for ANC service, antenatal service. There is quite a number of women who are still in the homes up in the villages, in our communities. Yes. But we are doing a lot. I said our Department of Health Service is doing a lot through the leadership of our governor also, and also the leadership of our CEC Health. Yes, we are doing a lot and using CHPs to assist that. So, you say that the woman dies. Yes. It is the most unfortunate. Losing a woman. Yes, that's the same way also losing a baby. And I said the worst one was losing both of them, which can also happen sometimes. And I want to say there are many causes that can cause a death of a woman. But the major one, which has been seen to be causing a lot of deaths in pregnant and breastfeeding mothers. Because we say a death of a mother who is already pregnant all the way until 6 weeks after delivery, we say that one is a maternal death. And we say that is a serious issue which needs to be audited. And I want to tell our viewers that I said our Department of Health, we always have what we call review of the cases. Maternal and neonatal cases. Neonate is a baby. Every week, every Wednesday, like today in the morning. And the person coordinating is the RH coordinator of the county. Yes. So they are always discussing these issues. What are the issues affecting our women? Did we had any death of the mother? Did we had any death of the newborn? What happened? What was the issues? It is a discussion, and it is always done virtually. And everyone is in, including the leadership and our CEC.
Nice.
So I'm telling you, we are doing a lot so that we make sure that we reduce those. Because we are not happy also. Yes. So the major cause which has been seen to be causing this is what we call postpartum hemorrhage and bleeding. Bleeding after delivery. Immediately when the mothers deliver, bleeding. And we say it again, this bleeding, how was the HP? How did the mother continue? Because I told you the baby also needs nutrients. That blood level of the mother will be affected if the mother will not be able to eat well. So how did the mother channel it all through a pregnancy? When she's going to labor and delivery, how is her HP level? How is the level of blood? Because if it is below 11, that is, we are saying it's already, that woman is already anemic. She's already anemic and she has not started labor and delivery. So we need all the women to build their blood level beyond 11, 13, 14. That will be good. So that as they go to labor and delivery, at least they have enough blood in their body. Because why am I saying so? During labor and delivery, after delivery, there is that normal loss of blood. So if the blood was already low in the body and you are losing even the smallest amount, will really affect this woman. That smallest amount may take the life of this woman. Because
so
we are saying
serious like that.
Yes, it's serious like that. That smallest amount, because if you are already having anemia, you lose even 100 mLs. It is already having an impact on you because you didn't have blood, but you are losing. And we are saying the normal blood loss is up to half a liter. So you go beyond half a liter, that's already excessive blood loss. Yes. And if this woman was already having anemia, even that 100 ml to 150 ml will be able to affect. And we are saying blood in the body. We know the function of blood. I don't want to touch it. The main one, carry oxygen to all the vital organs. So if you don't have blood to carry oxygen in the vital organ, what are you saying? We are compromising the vital organs of the body, and which can lead us to that death. So that postpartum hemorrhage, bleeding after delivery, is killing women. I'm
saying that's
also,
the most common.
It's the major one. Yes, which is killing our women.
All right.
Yes.
And you said the way to work around that is that make sure as a mom you have enough blood.
Yes.
So how do people do that apart from the supplements?
Apart from the supplement, we have the diet. We have that diet that you will be advised, which are the best food, group of foods, which will always build your blood levels. And also, if the anemia is severe, you can have blood transfusion before you go into labor and delivery. Yes. We are saying there are, we say blood groups, groups of food nowadays. We came from the balanced diet. I know many people will understand the balanced diet. We say mix with a lot of vitamins. Group of food having a lot of vitamins. Those food which are rich in iron. Milk, fresh milk. We have animal protein, we have plant proteins, all that. We are saying that has a mixture, and that one now will be able to be guided so that you don't also eat the same one. So when you come to the health facility, the counseling, I say that is part of it, the nutritional counseling. You will be advised according to what you have at home. You don't tell people to go and buy what they don't have. They could not be having money. But when you discuss together, we discuss what is locally available, and we discuss together, and we advise you those food which are rich in ions and rich in vitamins, which will be able to build your blood. So I said the major cause is what we call the PPH, postpartum hemorrhage. The bleeding which occurs immediately after the mother delivers is what normally kills a lot of our women. Because by nature of its own, I say the mother are supposed, normally they bleed. But now it depends the amount. What causes this? The major cause of this postpartum hemorrhage is what we call the uterine atony. The uterine atony. The uterus have not gone back to its normality.
Yeah.
Immediately when the baby comes out, remember the baby had already extended the uterus.
Yeah.
That uterus was already extended. All of a sudden, you have the baby out.
Yeah.
Then again, you have the placenta. The placenta had already attached itself somewhere in the uterus. And when the placenta detach itself, what normally done in that area where the placenta is supposed to seal off. But sometimes it takes some time. So that is what we call the uterine atony, to seal off.
Okay.
So if it takes some time to seal off, it continues pouring blood. Remember, the placenta was the only connection between the mother and the baby.
Yeah.
The placenta was the one transferring nutrients from the mother to the baby. So immediately after the delivery of the baby, the placenta is supposed to come out. And now the uterus is supposed to do what we call it contracts. When it contracts, it closes those blood vessels which are already open and stop the bleeding.
Okay.
And when it comes to when a woman delivers in the hospital, there is an assistance which can be done. There's an injection which is given to assist in that. Okay? So you find most of the time that is the major cause that causes bleeding. The uterine atony. The uterus is not able to go back as fast as possible. So what happens to this woman? Continue pouring. Continue pouring blood. Yes, and you pour blood in the body, you drain yourself off. The blood comes out of the body and you don't have any other blood going inside. I say the compromise again. Yes.
But you say there's an injection for that?
Yes.
So at least there's good news there, as long as you make sure that you're delivering from in the hospital, not from home, surely. Please, let's do better there.
So when the woman delivers in the hospital, and I say the major cause was that one, which is 70% of the cause of postpartum hemorrhage, that bleeding, is the uterine atony. But when a woman delivers in the hospital, she is in savings. Why am I saying? Because I say there's something which can be done, to counteract that, because it is something which is normal, which can happen. So there's something which can be done. She receives some injection which assists that. There are some intervention, and also the examination. They would want to examine and get to know what is happening, what could be happening. Is it also only in the uterus, or there are other factors? This woman could have gotten some tears, and maybe she could be bleeding from those tears. So all that is an advantage gotten from a woman who is delivering in the hospital. She will be given all that emergency care. We said any bleeding after pregnancy, even before, is what we call an obstetric emergency. It is an emergency. You leave everything, attend to this woman who is bleeding, and you assemble everyone. We said in hell, we say you shout for help. When you have a PPH, or we say a postpartum, you are bleeding. A woman who bleeds excessively after delivery, that's an emergency. You cannot deal alone. You see, now you call everyone expert, and you come and assist this woman, and you control as the shortest time possible.
All right.
So what happens? Again, there's so much which can be done. And I want to tell you, I said again, our Department of Health has done a lot through the leadership of our CEC. The training which was done. There's always continuous training of equipping healthcare providers. The nurses, who are the front line. The nurses are the front line. You see, the nurse is always there, even from the dispensary all the way until the hospital. And you see, we are encouraging the women to deliver. Starting from all the way level 2, 3, and climbing up. So the training which was being done was to continue equipping the service providers with the skills to manage this. We call them obstetric emergencies. Number one being the bleeding, and many others. There are many others which they were also dealing, because I say that is killer number one. We have killer number 2 and killer number 3 and all. Killer number 2 being hypertensive diseases. I said hypertension. The woman confirms. What are you doing? Compromise the status, and also for the unborn baby, especially in pregnancy.
But as you've said, is that small headache, go to hospital.
Yes, don't treat yourself.
Okay. Very important.
So I was talking about the training that was there last week. Yes. So a group of healthcare providers were taken through the skills of managing obstetric complications. And the milestone of that training, apart from the skill, was the procurement of the what we call NASG, anti-pneumatic shock, non-pneumatic anti-shock garment. Because when somebody bleeds excessively, you go into what we call shock.
Okay.
So the system, the organs shut. Yeah? Mama jiski, tunasema ameenda into shock. Because the systems now doesn't have any enough blood, enough oxygen, nothing. So what happens? It shut down. The woman is already in shock. So we have that anti-shock camel. And this anti-shock camel is now available to our health facilities. And we are telling mothers now it is even safer. Because even if the doctors and nurses will be trying the other means, if that one is not able to work, or you are in the periphery, periphery means maybe dispensary or a health center, you need to be transferred to our level 5, Nakuru County Teaching and Referral Hospital. In the process, you already bled, you have gone into shock. How do you transfer you? We need to transfer you inside that camel. We call it anti-shock camel. It is a medication camel. It is now securing the little available blood in only the vital organ, so that you are able to reach wherever you are going, so that they are able to get intervention now, maybe blood transfusion and the rest. Yes. So that was a step ahead. That at least now they will be referring and they have something that will be keeping our mothers alive as they move to the next level of care. That was a plus. Yes.
I absolutely love how the training looked like. And maybe just for the people who weren't able to attend the training, how frequently does the trainings happen? Probably yearly?
Yes, how frequently is, we have what we call on-job training, continuous, every day. That person who has been trained, you go and train somebody else on the job. As you work together, you train that person. Then there are other things we call mentorship. Again, you go and mentor somebody who is also weak on that area. You have identified, or that person is having some deficiencies in a skill. You go and mentor that person. They are mentorship. And there are regular updates which are being done and organized through the Department of Health, through the Department of Nursing, and also the Department of Reproductive Health, headed by County Reproductive Health, Nancy.
All right. Perfect. And Sema, good morning, MBCI. How long should our CS scar take to heal? It's 5 months and still painful when it touches the area, and also I feel some numbness in the left part. Should I be worried? Anita Karo kutoka Embo. Now we're reading some of the questions.
Yes. Caro, I think she was done CS. She's saying 5 months down the line, she's still having some pain.
And some numbness.
Yes. The normality, because even for the normal pregnancy, we say between 4 to 6 weeks, 1 month, 1.5 months, the mother should be able to go back to it. The body of that woman should be able to go back to pre-pregnancy state. Even for those who have been done CISA, it doesn't have any difference. Maybe for healing for them, it's slightly moved to up to 8 weeks. But from 6 to 8 weeks, everything is supposed to have healed and gone back to its original pre-pregnancy state. But if she has some worries, I don't know, she needs to visit a health facility, discuss with the healthcare provider her concern, and then she can be assessed.
But she's saying it's 5 months.
5 months, I don't know. We can't tell, because she's saying numbness, she's talking of other things. She could be also having, there could be other underlying issues, or she could also having also psychological, I don't know, but she needs to be addressed what are her fears. So the best thing is she needs to visit or see a doctor or a nurse and discuss her issues, and then she can be examined. The best she will be examined. So let her not stay at home again. Let her make a move to seek help. It is better to go and be told you are okay.
But allow her to home, and then probably there's something. So please go get checked. And I say, hi, my name is Esther, and I say, I have a 5-week-old baby and struggling with breast milk. What should I do to increase it? And I said, he also has a mild cough. Is it too early to start on medication?
Yes, I know we are for now postnatal. Postnatal. Let me just say something about postnatal. I say there are danger signs of a newborn, and she needed to watch refusal to breastfeed, that fever, confusion of the newborn. Also for depending also on the stage, the redness of the stump, the umbilical stump, the yellowness of the body, the yellowness of the eyes, the palm, also that is a danger sign. And when she talks about the breast milk, we are encouraging that all babies delivered should be exclusively breastfed for 6 months.
6. Yeah,
No
for
additional. The first 6 months.
Yeah.
No additional. Not even water. Except only for medication.
So medication is okay at 5 weeks?
Not, I'm coming there.
Okay.
Except only for medication, which has been prescribed by a doctor. You know, there could be other babies who could be on medication. Yeah.
Okay.
So that's only what is allowed. So what I'm telling I can't remember Esther. Is when she says she's struggling, it's not very clear. Does it mean that she doesn't have enough milk?
She's saying she doesn't have enough milk.
Yes.
She's asking what you would do to increase it.
Yes. There is no woman who doesn't have enough milk for her baby.
Yeah.
The only thing is, how is your diet? How do you feed yourself? Because you need to eat those food which will assist you to produce breast milk. And we are saying this should be group of food rich in protein, rich in vitamins, rich in iron, and a lot of fluids, so that she is able to get enough breast milk.
Okay.
That is the only thing. So if the woman is able to eat like that and breastfeed the baby on demand, you are saying on demand, because the more you breastfeed, the more breast milk is produced. I think that should be known by all the women. And also the best way you attach your baby. So if you eat well, you produce enough milk and the baby is able to get enough milk. So she needs to go maybe discuss with nutrition. Then she can be advised how to eat, because the only issue is the nutrition part of it. She needs to eat well, and definitely the breast milk will be enough. And the baby suckles oftenly. So that she is not tempted to bring other food. Yes.
Okay.
So she needs to eat well.
Sawa sawa. And as you've said, is that hakuna mtu mwenye hana enough milk for the baby. Please consider that as well. But of course, if there's any issue, she should.
Yes. I'm saying we don't rule out any. Because there could be a mother who becomes sick in pregnancy. We are saying all that. But when they visit health facility, she could be assisted. But all babies exclusively breastfed because of so much advantages of breast milk. And it is workable. Yeah, it is workable. She doesn't have to doubt that.
All right. I have someone asking if they'd go to hospital before pregnancy, and she's asking about the importance. I'd advise you to, as you were starting this conversation, you talked about the prenatal or pre-conception care. Yes, and you talked about why that is important. We said that you should go to hospital 1 month or 1 year to 6 months.
6 months to 1 year.
6 months to 1 year.
Yes.
Before pregnancy. So it's very important for you to go and get checked. Umuliza about the importances. Utapata hiyo yote hapo. So please just go back. We have this particular recording on MBCI TV Facebook page and MBCI TV official YouTube page. So ukienda pale, angalia Afya Clinic ya leo day 26 of March 2025. While you're starting this conversation, you'll get help on that. All right? Perfect. I'll just read the last one. Anasema, okay. Anasema, I gave birth 4 months ago. Nilijifungua normal. He weighed 5 kg. Anasema, until today, queefing haijaisha. Should be what that? Maybe just explain vizuri. There's something we haven't gotten from your message. Until today, nini haijaisha. Yeah. So I've gotten you say that he weighed 5 kgs. Ulijifungua 4 months ago, normal delivery. So tell us, there's the last part you haven't explained very well. We haven't gotten it. Yes, so I have seen your message.
Maybe I just say something as she get to know to become clear. I said with normal delivery, all your body should be able to return back within 4 to 6 weeks. If it is normal delivery, if it is cesarean section, 6 to 8 weeks. But anything you feel it is not normal, go back. Go back and you will be assisted.
Go get checked. It's very important. It's very important. But also, in the same is that explain so that we'd be able to, understand more what you're saying. Now, what would be your parting shot in the discussion that we've had today, in everything that we've talked about so much, but all very wholesome, and I'm hoping that we'd have another chance to talk about a miscarriage, which is a topic that is is really wide. I'm praying and hoping that we'd have that chance. But for now, for today's discussion, what would be your parting shot?
Well, my parting shot today is every woman has a health and her hands. And she has all the powers to drive that with a successful, a healthy baby and a healthy mother. It is very possible. Seeking behavior, we need to change. We start clinic early. We start even before. We come to clinic early. Anything you feel or you hear in your body, move to the health facility. Deliver in a health facility. You are in better hands. Breastfeed the baby for 6 months and you will be in better hands. All that, when we journey together, we shall be able to have a healthy Nakuru, a healthy county, a healthy nation. And furthermore, we shall be able to reduce the maternal mortality and perinatal. That is the death of the mother and the death of the baby. I only talked about the number one. And I say there are other causes which are also killing women, but not at the high rate, which is like bleeding. And I said we have the 5 killers. Number 1 is bleeding. Number 2, hypertension. Number 3, what we call obstructed labor. That there is a mismatch. Then we have number 4, which is abortions. And then we have number 5, indirect, like HIV, other conditions. So let us assist one another. I want to really beg our mothers of reproductive age that let us journey together. We are there to support you. The Department of Health, Nakuru County, so many has been done, so much has been done. All the health facilities, majority of them, all of them have been equipped with everything that is needed to assist that woman. Service providers are there. Nurses are there waiting for you. They are already equipped with knowledge, waiting for you. Kindly use this. Let us use this information, let us use these services, and we move forward. And also give us feedback so that we are able, when you come and use our services, we shall be able to get feedback from you so that we get to know where we are improving. So I want to tell them everything is possible, and if we work together, even including UNPCI, you assist us advocating for this, we shall be able to reduce maternal mortality. There should be no woman dying. Sincerely, there should be no woman dying during labor and delivery, and there should be no baby who is dying. We are saying that is our face behind that death.
Perfect.
All we can.
Now for the ladies who've heard you and they'd love to start their journey with the healthcare providers in their journey in pregnancy, where can they get to? And maybe if you have a number you'd share.
Yes, I want to say they can, number 1, they can visit any health facility near them. Number 2, they can reach on me on any direction or in any advice, and I will be willing, rather willing. Yes.
Perfect.
Can I share my number?
Yes, please.
So my number is 0722 434 992.
Perfect.
Lillian.
Again?
0722 434 992.
All right.
So she will be able to reach on me, and we have a team we are working with. I say the Department of Health we are working with. We have the leadership, we have the department, we have the reproductive health, where we have the RH coordinator, and I myself, I want to finish by saying also, I deal with the prevention of mother-to-child transmission of HIV. I am making sure that no baby is infected with HIV or syphilis or hepatitis B in the county. And I was coming here on Department of Health and also reproductive health coordinator.
Perfect. Thank you so much for being here. That has been such a wholesome conversation, and I know that you've learned something from this particular conversation. Now, the number on your screens, maybe you can just get it again. So the number on your screens is Lillian's number. She's the nurse that we've had on board today, and I know that once you're able to reach out for any concern that concerns the your reproductive health, you'd be able to get help. But thank you so much for being here. Thank you for tuning in. We do value your time greatly. This has been Afya Clinic right here at MBCI TV, where we transform lives by the grace of God. And I'm hoping and praying that today your life has been transformed in one way or the other. Thank you so much for being here. I know there are questions that we've not been able to read, but we've given you the contact. So if you have any question that is really burning and you've not been able to address it in the conversation that we've had, please feel free to call or text. Call or text, yeah? Yeah. Feel free to call or text and you'll be able to get help. Once again, Lillian, thank you so much for being here. We've had a good time. We are truly grateful.
Thank you, Rachel.
Yeah.
Thank you for giving me the opportunity and giving our Department of Health.
Yeah.
Because at least you have gotten an opportunity to reach those women which you have not reached.
Yeah.
And looking forward to other many.
Awesome.
Thank you so much.
Perfect. Now we'd love to know, do we have the Did You Know as we wind up? Okay. Perfect. So we'll get the Did You Know segment. Should be on tomorrow and Friday, so that you jog your mind kidogo or the other things, you know. Martin, he's there to make sure that we have something, you know, to think around and to research about. Others, thank you so much once again for being here today. My name is Rachel Kahogo. We were here from 7:35 where we had some music up to 8, and of course we started this discussion on your reproductive health, and we've talked about so much. So share this link as much as you can, and I know that it's gonna help so many people. Others, once again, asante sana. Have a blessed, amazing rest of the day. But of course, we'll be having the lunch hours from 12:30 to 2:30 today, right here at Kingdom Seekers Fellowship Nakuru. So if you're in Nakuru and its environs, please come so that we'll be blessed together. But of course, we say that at MBCI it's a family TV, so we have amazing programs lined out for you. God bless you. God be with you. Have an amazing rest of the day. Bye bye.